Hi, everyone. Thanks again for joining us for our a weekly virtual town hall. We are really doing these based on the feedback that we get from you all about what's of interest to you. And we've gotten a lot of questions about how COVID-19 is impacting rural and border healthcare. And so, we already knew before this that our rural and border communities were so underserved. Texas has the most rural hospitals that have closed in the last 10 years. We lead the country with 20 having closed. Just in Texas 23, in the 29 counties that make up this congressional district, 18 counties have 3 or less doctors, 3 counties have no doctors, right? And so we are seeing, unfortunately, the result of the underinvestment and the lack of infrastructure as we're dealing with this pandemic, but it's disproportionately impacting our border and our rural communities. Folks have heard me often talk about why healthcare is so important for me. When my mother was diagnosed with colon cancer, I came home to be with her during that time. And it was only because she had quality, affordable healthcare that she was able to make it through that, thankfully. And so this is something that I look forward to fighting for and making sure that everybody in Texas 23 has the healthcare that they deserve. And so today for our discussion, I am so honored to be joined by Dr. Adrian Billings. He serves at the Preventive Care Health Services, which serves West Texas. They've got clinics in Alpine, in Marfa, and in Presidio. Dr. Billings also serves as the co-president of the Presidio and Ojinaga Binational Health Council. And this is, we'll talk a little bit more about kind of what that is and how they are functioning in times of COVID-19. So if we go along the border, we are also joined by Marlon Ramirez, who is a community health worker instructor based in Del Rio, originally from Eagle Pass, which she's always reminds me that she's originally from Eagle Pass, now works in Del Rio and serves both Valverde County and Maverick County. And Marlen serves as the co-president of the Amistad Cotrina, which is a Trinational Health Council. I think it's formally a binational, as it includes Del Rio and Ciudad Acuña, but they also have participation by the Guatemalan consulate, so it's technically a Cotrina. And both of them are going to speak again about their roles in those various capacities. As we know, and in the time that I've been fortunate to spend in our border communities, those ties between those communities are sources of strength, right? Cultural, social, economic, and certainly in these times, if one thing happens on one side, it's very quickly going to be seen on the other side, and that's why the function that they perform as co-presidents is so important. And I'm really excited we're going to get to hear from them about their work. Just a little bit about that, just because folks might not be super familiar with what the Cobinas and Cotrinas do. These were actually set up in 1963, and there are 8 in the entire state. 3 of them actually sit in Texas 23. So we've got the one in Presidio and Ojinaga, we've got the one in Del Rio and Ciudad Acuña, as well as the Guatemalan consulate. And then we've got the one that serves Eagle Pass, Piedras Negras, and the Kickapoo traditional tribe of Texas, right? So that's another technically Cotrina. And then we've got one just outside that serves Eagle Pass, El Paso and Juarez. So, so critical given the 800 miles of border that runs in this district, and obviously, healthcare being the #1 issue in this district, as I hear time and time again. So thank you again for joining us, and thank you for the wonderful questions that you submitted again, and we're just going to jump right into it. Let's see here. So the first question comes from Hudspeth County. COVID-19 has led to healthcare providers shifting to telehealth, right? But broadband connectivity is still a challenge in many of our rural communities. In your experience, has this been an issue? And if it has, what can we do to address it? And Dr. Billings, if you want to kick us off.
Sure. Thank you, Gina, and buenas tardes, and good evening to everyone on the Zoom chat. Yeah. So really, the way that medicine is now being practiced and recommended because of the COVID-19 outbreak is to try and convert to telehealth visits. And when we started rolling this out several weeks ago, we were doing telephone visits until we found a HIPAA-compliant platform that would allow an audiovisual connection. Mm-hmm. And, as we knew and as we worried about we're discovering that a lot of people don't have internet connections in their homes. They don't have a smartphone. They may not have cell service out, in our rural communities between Sierra Blanca and Van Horn and Valentine and Marfa and Presidio and Alpine and Marathon, going to Sanderson and Del Rio. There are just vast areas that there are no Wi-Fi or internet service available. And so it's an extreme challenge, especially for those that are socioeconomically disadvantaged, that maybe they would have access to it, but they can't afford it. They can't afford the smartphone, or they can't afford the internet connection. So it's a new barrier to healthcare right now.
Marlen, how is that affecting your work in Del Rio and in Eagle Pass area?
Same thing as Dr. Bennett mentioned. We do know that for some people it is something that they don't have access to. However, we do encourage it if they do have the resources. But on the positive side, what we've seen those that have access to it, they do use the service, and those that do not have access, they can call in the office. If the doctor recommends for them to come in, then they go ahead and come in. But that also helps keeping some of the people that have access to it to keep them at home. And it gives those that go to the clinic, they're not exposed to that many people. So it's a plus on both sides. It's a plus for those that have the service and they can use it at home. And for those that are not as fortunate, when they go to the clinic, they don't see that much traffic of patients there. So it has its goods and it has its bads, but for right now, this is a learning process for everybody, and we're trying to make those resources available as they come in.
Are you, when you're talking with your counterparts through the Cotrina or the Cobinas, are they also leveraging telehealth? And is that primarily how you all are engaging with those colleagues?
Yes. So because we can't usually meet on a regular basis, we have to use these resources. Also, what we've been doing, just keeping the community informed. That's our main thing. Using social media, using the resources that we have available to inform of the community of how they can access care at this time.
Great. Did you want to add something, Marlen?
No, that's
one of the things that we're reading about, unfortunately, is at the time during a pandemic, this is when we need all hands on deck. And unfortunately, we're seeing repeatedly that our rural facilities are actually laying people off right at the exact time that, again, we need as many providers as possible should something happen in many of these already underserved communities. I think we read about the Big Bend Regional Medical Center, experiencing some of these things. Can you talk about how that pandemic has affected the stability of rural healthcare providers, and what do you think will happen in the long term if we continue to see a decrease in medical health providers, especially during this time?
Yeah, so you're spot on. So this is a really question that hits home for me, because here in Alpine, as you mentioned, Big Bend Regional Medical Center this past week did file Chapter 11 bankruptcy protection. They're still operational, but we're worried about the future of what the hospital means. And as we have appropriately reduced volumes in our clinics and in our hospitals, and decreased elective surgeries that are all appropriate, the healthcare industry is not immune from the financial hits that every other industry in our country is facing right now. And so as we're having decreased volumes, there's decreased revenue coming in, and there's lower revenue also for telehealth visits as well. And so we're worried in the federally qualified health center community, in the rural health clinic community, critical access hospital community. There's not a sector of healthcare that is not going to be impacted by the decreased financial revenue. And this really illustrates that we do, and this is a bias from me, that we do need to invest more in all of our industries, and especially during a pandemic in our healthcare industry, to keep all of our healthcare workers available and working and healthy and safe.
Yeah. As even before this pandemic, as I've checked in with and gotten to know some of our rural healthcare providers, one of their constant challenges, even absent a pandemic, is just recruiting and retaining talented staff, right? I mean, if we look at the numbers, and this is, I think, really an issue that we have to think about more strategically, even at the federal level, is the pipeline of talent into rural healthcare, right? If we look at the number of rural healthcare students right now, even if every one of them graduated and returned to a rural community, we'd still only meet 25% of our needs in the country. And so I think, as I've talked to rural healthcare providers, their concern is that it'll take them a little bit longer to rehire those folks after this if they have to lay off so many, which means then that our rural communities, our border communities, are that much more underserved for a little bit longer than they might be in some of our urban areas. So I really want to talk about your work on the Cotrina and the Covinas, because again, it's such a something we don't hear enough about, but it's just so critical. So Marlen, can you talk about your engagements with your Mexican and Guatemalan counterparts, and what does that look like? On how frequent, what are you talking about? What were you talking about prior to COVID-19? What are you talking about during this pandemic? Help us understand what that looks like.
Yes, so our Cotrina meets monthly. We are a mix of different organizations in the community, and our goal is to find health-related issues that our community is facing at the time. Like you said, because we are a border city, same issues that we have here, we have them across as well. Mm-hmm. So our goal is to work as a team and identify how we can reach the majority of our community and inform them of the health-related issues that we're facing. We try to conduct community events. We have, like I mentioned, a social media page in which we share information, resources that are available, and that's mainly our goal, just keeping the community informed at this time, of course, keeping them safe, and just it's everybody pulling in their resources together and hope for our community to be healthy and be informed more than anything.
Absolutely. Dr. Billings, did you want to add something to that?
Yeah, and so the Presidio Ojinaga Binational Health Council, we were meeting monthly until several years ago. We had some budget cuts, and so we now meet bi-monthly up until the pandemic. And this pandemic has obviously changed how we all practice, and so we're now planning on doing virtual meetings until hopefully the pandemic has died down. But it's so on those bi-monthly meetings, we meet in Presidio at the Texas Department of State Health Services office there in Presidio, and I'm always amazed at how many healthcare professionals from multiple disciplines come across from Ojinaga, take the time to cross the international bridge, and they far outnumber the number of Texas healthcare professionals that are there from the Presidio side, because we're a much smaller community than Ojinaga is, Presidio is, that is. But it's just such great camaraderie, and it is recognized, and great fellowship. And it's very academic. For rural healthcare, this is really where we have invited and regularly have Texas Tech University Health Science Center faculty come out from El Paso and Odessa and even Lubbock, from University of Texas El Paso. And they're really coming out trying to share and spread their resources and their knowledge. So it's almost like your grand rounds that we had in medical school and residency. And so I'm always really impressed and excited about the meetings. But again, I'll echo what Marlen said. It's really recognizing that the Mexican citizens and the Mexican healthcare clinicians and officials, they have the same issues that we do on the Texas side. And so it really just helps us realize that we're really all the same people. We're separated by an artificial boundary, the Rio Grande, but we're really all fronterizos. We're from the border.
One of the things I would hear often when I was in Del Rio or Eagle Pass in Presidio, the number of people that actually will seek care, right, medical care in Ojinaga or on the Mexican side, frankly due to cost, right? And so now that the border has been restricted to only essential travel, how is that impacting the type of services that you have to provide on the U.S. side when some of those folks would traditionally cross the border to get it there? How is that impacting your clinic?
Yeah, so 5 of our Presidio healthcare clinic staff live in Ojinaga. So they commute across from Ojinaga to Presidio daily. And so several months ago, when the White House said that they were going to shut down the southern border, we were really worried about still being able to be operational without those 5 staff. And so those staff now, they're staying with friends or family in Presidio Monday through Friday. And they're still allowed to cross because they're considered essential personnel, but it definitely is a little bit more challenging. And certainly, yeah, in Presidio, which is a town of 7,000, there's no mammography services. There's no pharmacy in Presidio versus a mile across in Ojinaga. There are multiple pharmacies. There's mammography available. They have services in Ojinaga that we do not have, our patients do not have access to in Presidio. When I visited my counterpart, the co-presidente, Dr. Acosta, in Ojinaga several years ago for the first time, I went to his house, and his consultorio, his office, is right in front of his house. And walking out of the door was one of my patients, and he was getting a second opinion. That really hit home for me that really there is binational healthcare, and that is great, and especially for a community like Presidio where there is just more abundant healthcare available in Mexico, and it is also at times more affordable as well. So again, it's a binational healthcare collaboration is how I see it.
Yeah. Marlen, do you have any your thoughts on that?
I agree. It is true. Our patients, due to certain factors, for the most part, it's financial. They go to Mexico to get service. Fortunately, because of the situation that we're in now, it's more than likely that they're not receiving that service that they need. But it is true. It is true. A lot of our patients have to go across to get services that they're not able to get here. So we have the same issues here, and the same, unfortunately, lack of resources for some of these patients. We see the same here in this border town.
This question just came in, and I hope you'll take a little bit of time to answer it. Last time when I was in, maybe a couple of visits ago to Presidio, I sat down with Linda, Dr. Billings, and on the way there, I had just finished reading an article that 2018 was the first year, right, since 2009, that we'd seen an increase in the number of people that were uninsured. And the highest spike within that was in the Hispanic community. And what they attributed it to is the fear that exists within many of communities, right? What raising their hand for healthcare, let alone any other assistance, could mean for their immigration case, or for that of the case of someone in their family. So if that was happening before the pandemic, how are you, if at all, seeing that during times of COVID-19? How is that impacting the care that you are able to provide to mixed status families or undocumented folks?
Yeah, definitely. There was a lot of fear with the public charge rule, and there were legal immigrants who were here legally who were declining public assistance, and because of fear of having that as a negative consequence, having a negative consequence of not being able to proceed legally in their path to their green card or their citizenship status. And there were several pregnant patients that we were taking care of at our Presidio clinic who, again, were here legally, were allowed to apply for Medicaid and refused to apply for it because of consultations with their immigration attorneys saying that this may kick you out of the process. And so these women were having to attempt to pay out of pocket for prenatal care, for prenatal labs, for a size and dating sonogram for their baby, and many of them couldn't afford it. And we were, as an FQAC, we were able to pick up some of that care and charges for them so that they were able to get them. But these were women that were potentially putting their lives and their unborn children's lives in danger out of fear. Certainly with this pandemic, what we're going to see undoubtedly is as more and more people get laid off and become unemployed, our uninsured rates are going to increase. And there's going to be more needs for places like federally qualified health centers and community health centers that are government supported to take care of these people. And so we really, in my opinion, we need to invest in our healthcare system in the country. And especially work on prevention.
Marlen, do you have anything to add to that? Are you hearing from folks that are concerned about raising their hand, even if they're they're here legally, but raising their hand and seeking healthcare out of fear that it might affect their immigration case or someone in their family's case?
Yes, that's for the most part always been the case. There's that fear of it affecting them and their status. Also, there's always that fear of if they're illegally here, they hesitate to ask for help or ask for resources that are available to them regardless of their social status. But I believe during this time, what's important is to remind them that their health is a priority. And, if they feel that they need that sort of resource, or for example, if they need to go to the clinic to get checked, that they need to worry about their health, because not only are they keeping themselves healthy, they're keeping their family and the community healthy as well.
Absolutely.
So I think that's something that we really need to emphasize, if regardless of their legal status, if they feel that at the time they must see a doctor, they must reach out to their local resources and say, I need help, how can you help? And that will help them keep safe our community as well.
Yeah. Marlen, this comes from Valverde County, so I'm going to let you answer it initially. In my town, people aren't really listening to social distancing, and most people are going about as usual. How can we get people to understand how important it is to socially distance, even if we're in a rural area with not a lot of positive cases?
So the most important thing here is listen to your local authorities. They've been on top of this. They've been informing the community. Yes, at the time we may not see a lot of cases, but we need to continue to educate the community of how serious this is, or how serious this can get. I know some people may not have fear right now at this time, but we need to just consistently educate the community. If we continue to educate them and know how important it is to stay at home, and we don't necessarily need to go anywhere, we need to do that. It's important that we listen to our local authorities. I know that that they constantly have social media. They're using social media to keep the community informed, but we need to really educate the community on how important it is to stay at home at this time.
Dr. Billings, we're also not seeing just a ton of cases in West Texas. I think we're also not seeing a lot of testing, though, right? Which I think you can confirm. So, any thoughts on the need to further social distance, even in the absence of a lot of positive cases?
It is still imperative. I echo exactly what Marlen said. We don't have enough testing capacity. We really need to be testing everybody to get a true idea of what the prevalence is. This is a infection where patients, a large amount of patients are asymptomatic throughout their entire infection, and they're also infectious. Those that do become symptomatic, we're hearing and they're finding that they're infectious prior to showing symptoms. We don't have adequate testing. We don't have a treatment for it. We don't have a vaccine. This is really one of those extraordinary infections and viruses that is out in Mother Nature, and we're limited as to what we can do. And social distancing is something that all of us can do. And that all of us can be heroes by washing our hands, by social distancing. And, many of our parents and grandparents fought wars and, were being shot at and whatnot. And we're just being asked to sit on the couch.
Right.
I'm putting in light, people who have been laid off, that's horrible, and people that aren't making income, and kids that aren't being able to go to school. I mean, these are horrible things, but in order to save lives, these are necessary things that we need to do so that we can, get through this and move back into life as hopefully normal, or some semblance of what it was before.
Absolutely. So this question comes in from Medina County, but I think it's a similar issue, right? Which is the lack of PPE, but also lack of ventilators in particular, right? These very basic things that our hospitals are needing. So how are in West Texas and in Valverde County and Maverick County, how are you all dealing with the kind of the lack of supply now and anticipating what you might need, and where are those resources potentially coming from?
Yeah, so I've got a demonstration. So this is one of my 4 masks, and I've done some art on it. I'm not a very good artist, but trying to bring some, it's a smiley face with a bear nose on it, trying to get some of my patients to laugh when I walk into the room with it. But I have 4 masks, and what I do is and this is all of our clinicians in our clinic and our nurses and our receptionists, is we each were able to give out 4 masks to each of our employees, and we wear it for a day. We put it in this Ziploc bag and we put it away. The virus is supposed to be gone after 3 days, and so this is bag number 3. So this is day 3. This is day 1, and then I have a day 2 and a day 4. And these are just surgical masks. We have some N95 masks, and those were what we're doing with those. They're supposed to be, each of these are supposed to be used single use only and throw away. What we're doing with our PPE, with our N95 mask, is we're putting them also in a Ziploc bag, putting them out in the sun for 3 hours. There was a small study in 2015 in the Journal of Occupational Medicine that showed that 3 hours of ultraviolet light would kill most viruses. So this is not ideal, but with the shortages of PPE, we're adapting and we're doing the best that we can. What's been really amazing is the community making their own masks and dropping them off to our clinic. I haven't showed you some of the beautiful masks that our community members have made, and so that's been amazing as well. So maybe I can do away with these and go back to the cloth masks.
Wow. It's really hard to believe, I think. It's the work that you all are doing every single day to keep us safe and healthy. And in the richest country in the world, in a state with a $1.8 trillion economy, we can do much, much better than unfortunately your do-it-yourself disinfectant approaches there. I realize, we're doing what we need to do, but so much of this seems needless, and we should really be stepping up as a country to make sure that you on the front lines have what you need. Just a reminder every single day of the need to vote in, good, courageous, competent people who can lead in a time of crisis, not cause and exacerbate it. Marlen, how is Valverde County, Maverick County, as far as also dealing with the supply of PPE and some of the health equipment that might be needed if something were to happen?
Like Dr. Billings mentioned, we are seeing the same shortage, but it has also been amazing to see the community come together. Everybody helping everybody in the best way that we can. But I honestly think that the key here that would help all of us is just doing our part, like we've been saying, just staying at home to help reducing those cases, help reduce the exposure. But it has truly been amazing, the community get together and everyone sharing their own skills in particular to help each other.
Good. I think we've got just a couple of questions left. And this one comes in from Presidio County. What can we do to support our medical workers and first responders in our rural and border communities? I think you all mentioned, people being very generous in making masks, but are there other specific recommendations or asks that you might have for folks?
Sure. I think continuing to social distance until we're hearing from our public health officials and experts that, we can begin to dial back on that social distancing. Continue washing your hands. Call before coming to the clinic. Call before coming to the emergency room if you think that you've got if you have contracted COVID-19 or flu-like symptoms, so that the healthcare workers can protect themselves and do that process. Continue to check in with your neighbors, continue to support others. I really like a quote from Mr. Rogers that times of stress, look for the helpers. And also, be a helper. I think this is an extraordinary opportunity that we can really coalesce as a country and not see ourselves as living in a red state or a blue state or a red or blue community, but see us again, all as human beings that all need health, we all need love, we all need shelter, and we all need companionship. And so my hope is that, this will be a time that we come together as a nation. And I think that we're beginning to see that.
Great. Marlen, do you have any specific asks, any additional comments to what Dr. Billings just mentioned?
I agree. Just practice what they're asking you to do, be knowledgeable of what the information they're giving you, and just positive more than anything. A text message, nowadays we all have social media. Take time to thank the people that are out there in the front line for us. Take time to thank them for what they're doing so that we can stay home and we can target this together. Like, now is the time to come together and fight this together, because we're all in it together. But I would just say that, like, stay positive, thank those that are out there, and just hope that we can end this soon and we can get back on track.
Absolutely. Well, Dr. Billings, Marlen, thank you so much for being a part of this and taking the time to share with us kind of what your day is looking like, not only as medical professionals in your respective areas, but also the very important work that you're doing with your foreign counterparts to make sure that our border and our rural communities are well served. Thank you for joining us again for our third virtual town hall. And if you know of somebody that would benefit from watching this but wasn't able to, know that we are going to, right after this, apply Spanish captions, right, and then post this on our Facebook page as well as on our webpage, and folks will be able to view this, in perpetuity, even if they weren't able to join us today. And again, this conversation, the conversation we had last week with 2 Texas State Board of Education members on the impact of COVID-19 on learning in South and West Texas, as well as the discussion that we had with Dr. Erica Gonzalez Reyes a couple of weeks ago, all of this has been based on your feedback about what you want to hear more about. So please continue to provide that feedback. We will continue updating our COVID-19 resource guide, which you can find on our website, as well as on our Facebook page, both in English and in Spanish. And we will see you next week. Thanks so much for joining us. Take care.
Thank you. God bless and be safe.
Thank you.
Thanks.